Hello, this is Delverine West Aarons. This is my second video journal. In my first journal, I discussed the fact that I was a nurse, pediatric nurse for quite a while, and that I had gained a lot of experience, but that I was looking forward to learning so much more because there was so much more that I had to learn. Well, actually, this was one of my best clinical rotations. I've had some that were not so good. But in this instance, I first have to say to my preceptor, I really appreciated everything that he did. He was very, very good at teaching. He gave conferences before we started the day, and this is not something he had to do. Sometimes when you're in a clinical setting, you kind of feel like you're not belonging and you're in somebody's way, or you might be taking time away from their patients. In this situation, Dr. Michael Zollicoffer did not make me feel that way. I felt at home and I felt comfortable enough to learn a lot from him. So with that said, in this clinical rotation, I learned a lot more about pediatric care. One of the things I learned was that you have to get information from the parents, and sometimes it might not be so forthcoming. So there are strategies that you have to use to get the information that you need. Also, when you are assessing pediatric patients, because most of the time they cannot tell you exactly what's going on. And again, in that instance, there are strategies that I learned that you can even use to assess pain in a pediatric patient without even asking them where the pain is. I've also learned a lot about rashes. I did not know that there were so many rashes presented in pediatric population. But I've come to the point where I can at least look at a rash, come up with a differential, and in most instances, I can actually make a diagnosis and create a treatment plan. So with that, I'm very proud. One of the things that I learned about myself in this rotation was the fact that I had some biases. When I worked in the clinical setting in the hospital, I would actually ask for 2 patients in the place of a patient with sickle cell. And the reason was I thought that their pain issues were not as significant as they were portraying it to be. And now I realize just how wrong I was in that regard. I encountered a patient in my clinical rotation who was 12 years old. And she was so emotionally labile. And she had gone through so much with her sickle cell disease. She had a stroke at 7 years old. She was having bi-weekly transfusion. She had a Broviac central line placed, and she was just so emotionally labile. And it really got to me when I saw her and the way that she behaved, and realizing that her pain was real, that the things that she went through was actually real, and that we as providers need to confront our biases and realize that sometimes we judge our patients, and that's not something that we ought to do. And for that reason, I am so looking forward now to learning about sickle cell, learning about the modalities and the treatments that are available, that I can actually help these patients, that I can actually be an advocate for these patients. And I think that I've come full circle in that regard, because I have to now face my biases. I do have some, and even though we don't want to actually acknowledge that, but I did realize that in this rotation that was one of mine, and I had to face it. Secondly, I would just like to say that I'm feeling a little bit more confident as far as being a provider. I know I'm not even quite there, but I'm trying my best to put myself in that role, because it's a major transition from being somebody who take orders to being someone who give orders. And that takes a lot of confidence. That takes a lot of chutzpah, so to speak. But the fundamental thing that we need is knowledge, and the fact that we always have research available, that we can go back and make sure that what we're doing is the right thing for that patient. So in that regard, I've developed a little bit more, but I'm still looking forward to other things to come in developing as a provider. I have to say thanks to my classmates and to all of my advisors and professors who have been so gracious to us, so kind and understanding. And for that, I really have to say I appreciate. So hopefully, if I have to do another video, it will be about being a provider. Thank you so much.